Welcome to the HSSC Advanced Technology Center online training series. In this stroke module, we'll focus on fast recognition, immediate bedside actions, safe escalation for imaging and treatment. Definition. A stroke is a sudden loss of brain function caused by interrupted blood flow, most often an ischemic blockage, and less commonly, a hemorrhage. A TIA looks similar, but resolves quickly without permanent damage. Because brain tissue is time-sensitive, rapid recognition and pathway activation are essential. Why speed matters. Every minute of untreated stroke costs brain cells. Our goal is simple: recognize symptoms fast, activate the stroke pathway immediately, and move the patient to imaging without delay. Recognize. Fast. Be fast. Scan the face for asymmetry. Ask the patient to raise both arms and listen for slurred or strange speech. If any are positive, lock the clock. Note the exact onset or last known well time. Also consider sudden balance problems or vision loss. These can be stroke too. Immediate activation. Call the stroke code out loud and share the last known well time with the team. Bring your essentials: oxygen and suction for safety, a monitor, IV access supplies, and a glucometer so stabilization and assessment can happen in parallel. A, B, C, D, E, and glucose. Stabilize first. Ensure the airway is clear. Give oxygen only if the patient is hypoxic, and secure 1 or 2 IV lines. Check blood glucose early. Hypoglycemia can copycat a stroke and demands a different response. Position and swallow safety. Elevate the head of the bed for comfort and to lower aspiration risk. Keep the patient strictly NPO until a swallow screen is done. Silent aspiration can turn a treatable stroke into a preventable pneumonia. Rapid imaging and SBAR. Move now for imaging. Deliver a crisp SBAR. What happened and when, current vitals, the glucose value, and any medications that thin the blood. This prepares the receiving team to act the moment you arrive. Blood pressure and monitoring, bedside. Maintain continuous monitoring. Follow your protocol for blood pressure targets. Too high or too low can both worsen brain injury. Treat marked hypo or hyperglycemia and keep the patient calm and comfortable. Differential and mimics. Think, don't delay. Think about common mimics: low sugar, post-seizure weakness, migraine, infection, or intoxication. But do not let that delay imaging. It's safer to rule stroke out quickly than to miss a narrow treatment window. Documentation, essentials. Capture the timeline precisely. Onset or last known well. Arrival, code activation, imaging start, and treatments. These timestamps determine eligibility for time-sensitive therapies. Quick SBAR example. Yes, 64-year-old with slurred speech. B. Last, 14:20 p.m. A. Fast plus BP 1, 6, 8, 92, glucose 104. R. Activate CT now. Mastering proper stroke recognition and early management is essential for reducing brain injury and improving outcomes. Prompt identification of warning signs, rapid activation of emergency care, timely interventions, and adherence to stroke protocols help save brain function and lives. Consistent awareness and fast action can make a significant difference in recovery and long-term outcomes. For more practical clinical videos and learning content, visit www.healthcare-eskilling.com. Thank you.